Hi, I'm Dr. Robert Alfonso at Lakeway Center for Cosmetic and Family Dentistry. I'd like to talk a little bit about sedation dentistry. A lot of patients, a good number of patients, can be fearful about going to the dentist and having some procedures done. And there's a variety of ways of getting patients relaxed. The first of which has been the oldest traditional way, and that's using something called nitrous oxide, more traditionally known as laughing gas. And what that does is simply gives a patient a conscious sedation while we're doing the work. After the work is done, we put the patient back on oxygen and they're back to normal. So essentially they could drive themselves to and from the appointment. The second level of sedation would be a conscious sedation using a medication. Usually this medication is a type of benzodiazepine like Valium or Halcyon. This medication is taken sometimes the night before to help patients get a good night's sleep, and then usually an hour prior to the appointment, and then a little bit more once they get to the appointment. With this type of sedation, the patient will need somebody to drive them to and from the appointment because they won't be in a state where they would be able to drive. But they are still in a conscious state, so they can respond to different things that we need them to do, such as taking impressions or checking their bite after a restoration is placed. The most profound sedation method is an IV sedation. This is usually done by an anesthesiologist that will come to the office and use an IV to sedate the patient. Again, the patient will need someone to drive them to and from the office. This sedation method is reserved for very nervous patients or for large surgical cases where the patient isn't necessarily needed to respond to an impression that needs to be taken or checking the bite with a restoration that's being placed. This has been some information about sedation dentistry. Again, I am Robert Alfonso at Lakeway Center for Cosmetic and Family Dentistry, and I hope this has been helpful.